Hi there, I'm Marcy Zwelling, and I'm talking to you from Los Angeles, California. And we're talking today to Dr. Stephen Tucker. I know Steve. I know him from Los Angeles, but he's not here anymore. He's moved to Singapore, and we're going to find out why medicine might be better in Singapore. Hi, Dr. Tucker.
Hi, Marcy. How are you?
I'm always good, thanks. So tell me, let's tell the audience a little bit about your training first. Where were you trained, and what were you doing in America before you went over to Singapore?
Well, as you know, but I'll let everyone else know, I trained at UCLA, and I trained in oncology, hematology, and bone marrow transplant. Subsequently, I practiced in Los Angeles at Cedars-Sinai, was a clinical assistant professor at UCLA, and moved in 2006 to Singapore to help develop a international clinical trials program.
And so you weren't deserting American medicine. You were just going over there to try a clinical trials program. That was the premise about moving to Singapore?
It was supposed to be for 2 years, and that was 7 years ago.
Aha.
And so we did the clinical trials program. We built a cancer center, a small one in Singapore. The second year I built a much larger center in Shanghai. And at the end of that 2 years, we decided it was a good idea, but a little bit ahead of its time. And it was suggested that we change gears and that I come home. Well, it was everything was true about that. We were ahead of our time, but I did not come home. I stayed in Asia. The opportunities, the way of practice, lifestyle, family, all just told me to stay here.
Tell me a little bit about the distinction between Singapore, lifestyle, medicine. Obviously, I know you and I know your heart, so I know that there was a reason, a very good reason, that you thought Singapore was the place for you.
Well, first and foremost, a lot of it has to do with family. I think raising my young family in Asia as expatriates, my children are so-called third culture kids, where they have a much broader understanding of the world. So that's a strong reason for being here. Also, practicing here just provides a lot of different challenges and opportunities that don't exist in the U.S. I didn't have any problems per se with U.S. healthcare, aside from the ones that we all know and the challenges that U.S. doctors deal with every day. But my patients now come from Russia, Thailand, Indonesia, Australia, the UK. So the whole mix of people that I see and the spectrum of disease is much more interesting.
Tell me about working with your colleagues over there. Here in America, well, we have our difficulties over here, as you well know, and among them is the communications thing and the fact that everybody is so busy that we don't pick up the phone, and so everybody kind of acts in a silo. Do you find that that's true in Singapore? Have you been able to integrate with other specialists so that you can help these patients in a variety of ways and really give them access to everything good about Singapore medicine?
Well, yes, and I think that's one of the main roles that I do play in coordinating care, particularly for, not just for cancer cases, but I have a pretty large general medicine practice as well of expatriates from around the region, and getting them plugged into all the right specialists and coordinating care is a challenge. I actually think that that's probably better done in the U.S., where there's a stronger history of both family medicine and internal medicine, where here we have a broad brush of GPs, which means these GPs have gone through medical school and a few years of post-medical broad training, but then they go out and they are traditional GPs. They don't have specialty training and specialty boards in family medicine or internal medicine. But Singapore stopped that system and now is just beginning to graduate their first classes of internists and family medicine, and no one can be a true GP the way some of the older GPs existed here before. The other side of that coin is we have a lot of specialists. And so they go directly from medical school into subspecialty training, and that in time basically creates some difficulty in coordinating care. But I think it's the same in both. I mean, Singapore is very first world. Communications exist. We have, in the public sector, a very good electronic health record. You could go to any hospital and pull up the lab reports or chest x-rays of any patient from any hospital in the public sector. So in many ways, that's a little more advanced.
That's interesting. Do you have any difficulties with privacy in those EHRs, or is that not an issue in Singapore?
It's well, I mean, it's an issue everywhere in terms of everyone wants to be assured of their privacy, but it's a non-issue here with respect to monitoring or abuse. You know, there's, like all places, I think there's the rare case of somebody looking in the wrong chart, but it's much more of an outlier than any kind of practice.
So you have an office-based practice. Do you go to the hospitals? Do you admit patients to hospitals?
Sure.
So, and in terms of getting privileges at those hospitals, credentialing and all that kind of stuff, do they accept the U.S. degree as you know, carte blanche, come on in and practice medicine?
The hospital is more, you know, originally the concern is, do I have a Singapore certification? So the U.S. degrees and all of that are only a prelude to becoming certified in Singapore. And after 2 years of being so-called conditional registration, I easily advanced to a permanent license, lifetime license in Singapore. So that's what's needed.
Not a problem.
Not a problem.
Do the hospitals function much like they do here in the United States? If a patient were to come to Singapore and, God forbid, have a medical problem and need to be admitted, would they find the same kind of systems there that they find here in terms of nursing, advanced nursing, and licensed, you know, practical nurses as opposed to registered nurses? Are all those levels of care available there, and is it the same kind of structure?
Pretty much, yes. I mean, it's pretty much identical. To put it in perspective, I no longer carry U.S. health insurance. I have a global health insurance for myself and my family. I'm more than happy to be treated in Singapore in the public sector or the private sector, or any of the named hospitals that I know around the world, any of the healthcare systems. I can be treated in the U.S. up to a certain amount, but otherwise I have no concerns about international care because I know where to go.
That's fascinating. Let's explore that a little bit, because here in the United States we talk a lot about health insurance, and there are a lot of misperceptions about what insurance buys you. So, well, first of all, who sells global health insurance? How would you get global health insurance?
Oh, this is a good one. So there's this thing. It's called Google. You type global health insurance, international health insurance, and I think you'll find a long list of providers. People you might not be familiar with, like Aetna and Cigna and you know, Blue Cross, Blue Shield. It's all the same.
Wonderful. And is it a catastrophic kind of insurance? So, or does it cover first dollar coverage in an office visit?
Whatever you want. Whatever you want. Yeah.
I mean, how does it, in terms of pricing, how does it, you know, relate?
I don't know. How much is insurance in the U.S. these days for a family of four?
Too much money. I will tell you that my husband and I, thank goodness, we are healthy. We have health insurance for the two of us. I will tell you, I'm 60. My husband is 69. And although he doesn't have Medicare, because here in the United States, because I continue to work, he has his Blue Cross as his primary insurance. We have what they call the most catastrophic of insurances with an HSA, and we pay up to $800 a month for our health insurance.
Okay.
We have never used it once.
Great. That's what insurance is all about.
Absolutely. But is that the kind of pricing?
Yeah. Yeah. For a family of four, I think I spend maybe $1,000 to have a pretty luxurious, package.
So, and this is important, I think, for our listeners, because one of the things that we've tried to do with Global Health is to explain to people from all over the world that healthcare is very much the same to the degree that you and I understand in delivering good care to patients. They need to have, obviously, the practitioner, I think, is the most important part of healthcare. You have to have a trusted physician. But when you go to some of these hospitals worldwide, in Singapore and in Thailand and in Turkey, these hospitals and these doctors are wonderfully trained. And what you're saying is that if you have a global health insurance, patients could choose anywhere in the world to get their health care. So if their specialist was in Turkey and that's where the care was offered, they could go to Turkey, which are wonderful opportunities that most people don't think about.
Right, right. But there's that cost of an airplane.
Indeed, indeed. But, the service is getting better, they say, these days. And that first-class service, all the movies, you get to watch lots of movies.
Right.
I was very impressed. I went on Turkish Air, and I went to Istanbul. And I was very impressed. They actually have a system where they pick you up at the airport and they take you right to the hospital. It's really just first-class service. And one of the things I was so impressed about was that some of the international hospitals, and I'd be interested in what you thought about Singapore hospitals, but the international hospitals really get the service concept. They were there to serve the patient. The hospitals were immaculate. The nurses and the doctors were at least as attentive, if not more so, to the patient. They weren't behind a computer filling out paperwork. The rooms that the patients had were absolutely luxurious. They understood that the family might be in the room. They actually had business centers in the room if patients wanted. I mean, they kind of understood what the patients needed. Do you find that to be true in Singapore as well?
Well, in the private sector, yes. In the public sector, it's important, and service matters to everyone. But let's not kid ourselves that what's important is healthcare, or surgical theaters, infection rates. Those are what's really important. You can't forget service. Clearly, it's important, but I wouldn't make my decision on where I'm going to have my bypass done on whether or not there was a concierge available 24/7. I'd rather make sure that there were nurses, trained in CPR.
Absolutely.
Yeah.
But I found that to be generally true. In fact, I had the opportunity of seeing a renal transplant in Turkey, and I was amazed at the size of the surgical theater and the coordination of care and the expertise, and it was really quite excellent.
Yeah, no. I mean, I think there's great care to be found everywhere. In the U.S., in Canada, in Europe, across Asia, but you have to be responsible for your own health, and I think that there are good dentists and bad dentists, and there are good mechanics and bad mechanics, and good accountants and bad accountants, but you need to be aware in advance. If you're dealing with health as a crisis as opposed to something on a personal responsibility in advance, then you're going to have less opportunity to choose wisely.
Sure. And I think you and I would both agree that generally health is an investment. People need to invest in their health and get themselves as healthy as possible. Accidents do happen, and
Right.
And that's where you have that trusted physician that you can call and make sure that the place that you go to is accredited. And I know that the Singapore hospitals are internationally accredited, which is something that I think American citizens don't understand, that there are international accreditations. And so that level of care that you speak of is definitely certified and credentialed by international experts who come in and do the same thing in your hospitals that they do in America. Yes?
Right.
Absolutely.
Right.
So you love Singapore. Tell me something about the life in Singapore.
It's hot. It's very hot in Singapore. It's either hot or hot and raining. Those are our two kinds of weather. But Singapore is a small town. We have 5 million people on the island. about 3.5 million Singaporeans. Um, it's very much first world. We've got everything that you would really want. Um,
And
yeah,
when I visited there, though, I was impressed at the cost of living. It was pretty high. Yes? No?
some things yes, some things no. The overall, I think it ranks pretty expensive. The real killer, housing, and it's transportation is cheap, but automobiles are uniquely expensive. One of the ways of controlling the number of cars on the streets is by taxing them. And as an example, I won't ask you what kind of car you drive, but let's say I'm gonna guess a Honda Accord, a loaded Honda Accord in the U.S. is gonna cost these days $35,000. Is that
Probably.
a good guess?
Good
It's
guess.
probably $150,000 in Singapore.
Holy camoni. Do you
Yeah.
pay lease? Do you buy used cars? Oh, my goodness.
So in all cars, cars are only allowed to be driven for 10 years. After 10 years, they need to be exported.
Oh, my
So
gosh. So my
yes, so
car would be.
cars are expensive. Housing, I mean, it's an island, so there's limited space, limited property, and that makes property prices quite expensive. But after that, I mean, you can take the MRT, you can take the subway for pennies a day. You can eat in what are called hawker centers, public food. They're food courts, but they're much better than that. Doesn't really describe it. For a couple dollars a day. You have to be careful about choosing healthy foods. There can be a lot of hidden fats, trans fats, some fried things. Service is very inexpensive. I mean, there's, jobs and what people are paid for certain jobs is dramatically less here than the United States. But overall, the quality of life is very livable. It's quite good.
And you
Um,
get a good education?
Great education. I
Are there
mean,
special schools for expats?
many, many. The Singapore American School here has 4,000 students. It's the largest international school in the world. I mean, that's bigger than a lot of colleges, K through 12. I mean, off the top of my head, I can think of 8 different international schools. United World College has 2 campuses. Canadian school, Australian school, French school, German school,
Wow.
Japanese school. Yeah,
Will you send your kids back to the United States for their college educations?
I think that'll be up to them, but that's probably the first choice. When you think of global rankings of universities, the U.S. still has the top 20 schools. But hanging out with expats does open your mind to other places, either in the UK, really in the UK. Those are other schools that come to mind.
Now, the education of physicians who your colleagues in Singapore, do you find that many of them were educated in the United States, such as yourself, or in Western Europe? That was my experience.
Yeah, the majority. There's a mix. The overwhelming majority have gone to medical school in Singapore, but have done some clinical training abroad, either in the UK, Australia, or the United States. Many of our colleagues have gone to medical school outside of Singapore. Singapore, until recently, only had one medical school with an intake of maybe about 250 students every year. That's numbers up to about 300. But if you didn't, I recently was speaking to someone about getting into medical school here. And I asked, what are the odds? If you apply, what are the chances of getting in? And I was told that it's about a 40 or 50% chance of getting in. And I thought, oh my, that's a lot easier than I thought. And then I dug a little bit deeper, and all of the students who apply have perfect grades and perfect scores.
Ah,
If you don't have perfect grades and perfect scores, don't even bother.
apply.
So those students who might be excellent physicians but have anything less than an absolute perfect score they may go to medical school in the US or the UK or Australia, and then just like me, when they return to Singapore, although they are citizens, they will have to go through a conditional registration process and go through the public system for training before they could consider going into the private sector or academics.
Interesting. Do you find that having physicians then that have been trained in such a variety of areas brings an interesting mix of clinical scenarios and methods of treatment? You know, sometimes physicians get trained at UCLA, as you well know, and you stay in Los Angeles, and so we all get used to doing the same thing the same way. Sometimes interjecting some new thoughts and new ideas is a healthy thing. Do you find that that's true in Singapore?
No.
Okay.
I think that it's fairly global, and what might be a small difference between New York, LA, and Dallas with the approach to, say, chest pain, there really shouldn't be much of a difference in the approach to most medical conditions. And also some of these processes are dictated top down. So just because you're a newbie from the Mayo Clinic and you come back, you're not really going to turn the department upside down upon returning from clinical training. So I think that medicine is fairly global, and we're evidence-based, and you go strictly by guidelines in those scenarios. I'll tell you what is different is that the panoply of illnesses that I see.
Sure,
So
tell me.
when was the last time you treated dengue or chikungunya?
Never.
Right. And when was the last case of active TB that came in your office?
I had a case recently.
Okay.
A Filipino woman came here. It was very interesting because indeed the culture is so different that explaining to her how difficult it was to treat her illness, and she had a very resistant TB, and she was pregnant.
Difficult.
Difficult. So when her child was born, she wanted to be with her child, but she couldn't. We had to separate them because she was not yet cured of her illness. And that was the most difficult thing, was culturally, was explaining to her how she needed to wait. In fact, we actually had to call security and really get people from her country and her husband, because it just wasn't something she could understand.
Right. The other thing that comes up is I pay more attention now to the reports about, say, the novel coronavirus from the Middle East,
Sure.
or obviously SARS, and I mean, a lot of these viral mixes come directly from China and the Mekong Delta. So getting some sun in my eyes there. But so getting some of those things, on our radar is very different as well.
I'm loving this. So I think I'm not sure I'm going to move to Singapore, but I think I'm going to have to come and visit you really, really soon.
Definitely.
Absolutely. So I think the lesson to be learned here is that medicine is the same worldwide. Doctors in their hearts want to treat their patients and do what's best for them, no matter where we come from and where the patient is. And the facilities need to be accredited, and we need to look at making sure that the right thing is done for the right patient at the right time, and that's all evidence-based, and that's a worldwide phenomenon. And that we actually all do talk to one another. And in fact, you said you were coming to the United States soon to work, to do some oncology, maybe not research, but go to an oncology conference or something?
Yeah, so people go to meetings. There's a meeting in San Francisco for breast cancer I will attend. Now I attend more often the European oncology meetings. I try to, attend some of these infectious disease meetings because there's just so many people coming from so many places. But that's not particularly different. But medicine is definitely global. Just picking up the phone, sending an email, communicating is at the heart of caring.
It absolutely is. I was telling you that last night I celebrated with my father his 90th birthday, and I had a party here in my office with my family of patients, and we had about 150 people here. It was a very proud moment for me because you know and I know that our patients are a huge part of our family. And when we go to bed at night knowing that they're tucked in safely, we feel much better. But that's an
Definitely.
international phenomenon, I think. Well, it's
Good.
a pleasure. Is there anything else you want to add, tell the world about medicine in Singapore?
It's not about Singapore, it's global medicine. I have patients in the States, patients in the UK, Australia, Singapore. I think people need to seek out healthcare that fits their needs, and I wouldn't be limited to just the doctor around the corner.
I think that's a wonderful message. I thank you very much. I wish you all the luck in the world. I am going to try to see you when you come to San Francisco. Thank you for being there. Thank you for being my friend and trusted colleague. Have a wonderful day.
Take care, Marcy. Good to see you.
Absolutely.
Bye.
Bye-bye.